What if your anxiety isn't just in your head, but also in your blood pressure? If you've been feeling tense, restless, or constantly on edge, there's a chance your heart is quietly suffering too. Anxiety doesn't just affect your mood, it triggers powerful physical changes. It releases stress hormones, tightens your blood vessels, and makes your heart beat faster. And when that response becomes chronic, it can raise your blood pressure and keep it high. The truth is, anxiety and hypertension are deeply connected. And yet most people, and even some doctors, overlook the link. In this video, we'll explore the hidden link between anxiety and high blood pressure, how it works, why it matters, and what you can do to break the cycle. If you're tired of battling anxiety and want to protect your heart at the same time, this video is for you. Let's dive in. What happens to your body during anxiety? And anxiety isn't just a mental state, it's a full body experience, and your cardiovascular system feels it first. When you're anxious, your body enters what's known as the fight or flight response. This is an ancient survival mechanism designed to protect you in life-threatening situations. But when anxiety becomes chronic and that stress response gets triggered over and over again, it starts doing real harm. The stress hormones surge. The moment you feel anxious, your brain signals the adrenal glands to release. Adrenaline increases heart rate, breathing, and energy availability. Cortisol raises blood sugar, suppresses digestion, and enhances alertness. Norepinephrine constricts blood vessels to raise blood pressure. This hormonal storm prepares your body to escape a threat, even if that threat is just an overwhelming thought or a stressful email. How this affects blood pressure. Here's what happens almost instantly. Your heart rate speeds up. Blood vessels narrow to push blood faster through the body. Breathing becomes shallow. Muscle tension increases, especially around the neck and shoulders. Digestive activity slows down, diverting blood toward muscles and brain. All of this raises your systolic and diastolic blood pressure, even if you're just sitting still. And when this happens, occasionally your body can bounce back. But if anxiety is constant, your body never fully resets. Your blood pressure stays elevated, which is where long-term damage begins. Short-term versus long-term effects. In the short term, anxiety-related BP spikes might not seem dangerous, but over time, repeated episodes can lead to damage to artery walls, increased workload on the heart, risk of chronic hypertension, reduced ability of blood vessels to relax. This is especially concerning for people already at risk for high blood pressure, heart disease, or kidney problems. Physical signs anxiety is affecting you physically. You may notice a pounding heart, feeling dizzy or lightheaded, shallow rapid breathing, tight chest or pressure, cold hands and feet due to vasoconstriction, feeling like your body is buzzing or wired. These are not just emotional symptoms, they're blood pressure symptoms too. Not every case of high blood pressure is caused by anxiety, but for many people, it's a major contributing factor. If your BP seems to rise during moments of panic, worry, or tension, it's likely your nervous system is fueling the pressure. The next section will break down how anxiety and high blood pressure become locked in a dangerous loop. How anxiety raises blood pressure, the science. We often separate mental health and physical health, but when it comes to anxiety and high blood pressure, the connection is direct and deeply physiological. Let's break down exactly how anxiety causes real, measurable increases in blood pressure. The role of the sympathetic nervous system. Anxiety activates your sympathetic nervous system, the branch responsible for your body's stress response, also known as fight or flight. When it kicks in, your body shifts into emergency mode, causing vasoconstriction. Your blood vessels tighten, increased heart rate to push more blood quickly, more forceful heart contractions to deliver oxygen to muscles, higher levels of adrenaline and cortisol, keeping you alert and tense. All of these responses raise blood pressure fast. And while that's helpful if you're actually in danger, the problem is anxiety triggers this response even when no real threat exists. What science shows. Studies have consistently found people with anxiety disorders are more likely to have elevated blood pressure, especially during episodes of panic or chronic stress. The more intense the anxiety, the greater the BP spike. People with generalized anxiety disorder often show higher baseline BP readings, Anxiety also increases systolic blood pressure variability, which has been linked to a higher risk of cardiovascular events. This variability is important. Constant fluctuations in blood pressure caused by emotional stress may damage blood vessel linings over time, even if your average BP isn't technically high. White coat hypertension, a common example. Ever noticed your blood pressure spike at the doctor's office? This isn't imaginary, it's called white coat hypertension, and it's anxiety-driven. Even people with normal BP at home may show high readings in medical settings due to anticipation, fear of results, embarrassment, stress-related bodily tension. And here's the twist. Repeated white coat episodes may increase your long-term risk of developing full-blown hypertension. The vicious cycle: anxiety causes high blood pressure. Then high blood pressure causes worry about your health, which fuels more anxiety. This becomes a self-perpetuating cycle that's hard to break without conscious intervention. And because both anxiety and hypertension can occur without obvious symptoms, people often go months or years before realizing what's happening. Your emotions don't just affect your mind, they reshape your cardiovascular system. Understanding this connection is the first step to gaining control, not just over your mood, but over your long-term heart health. Next, we'll explore how chronic stress turns into chronic hypertension and how to stop it before it goes too far. Chronic stress and hypertension, the vicious cycle. Anxiety isn't always explosive. Sometimes it lingers quietly in the background, a slow, steady hum of worry that never quite goes away. And that's exactly where the danger lies. Because when stress and anxiety become chronic, they begin to reprogram your body, leading to persistently elevated blood pressure, even when you're not actively feeling anxious. Chronic stress equals constant activation. Your body isn't designed to be in fight or flight mode all the time, but if you're dealing with daily stressors like work pressure, financial worry, relationship tension, or social anxiety, your nervous system can get stuck in the on position. That means your blood vessels stay slightly constricted, your heart rate stays elevated, your adrenal glands keep pumping out cortisol. Over time, this damages the flexibility of your arteries, making them less responsive and more rigid, a hallmark of chronic hypertension. Behavioral patterns that make it worse. Chronic anxiety also leads to habits that indirectly raise your blood pressure, including poor sleep, insomnia and fragmented sleep worsen, BP regulation. Stress eating. High sodium comfort foods are common in anxious states. Skipping exercise. Fatigue and low motivation often stop people from moving. Caffeine or alcohol reliance, both of which can elevate BP when overused. Smoking, often used as a coping mechanism, but extremely harmful to BP and heart health. These behaviors create a feedback loop. More anxiety, unhealthy habits. Higher BP, more anxiety about health. It's a loop many people don't even realize they're caught in. Long-term consequences. If chronic stress goes unchecked, it can lead to persistent hypertension, left ventricular hypertrophy, your heart muscle thickens, increased risk of heart attack, stroke, or kidney disease, greater chance of developing depression or burnout. And here's the tough part. You might not feel any symptoms until serious damage is already underway. That's why breaking the cycle early is crucial. Recognizing the pattern. Ask yourself, do I feel tense or overwhelmed most days? Do I notice my heart racing when I'm not even moving? Have I had higher blood pressure readings despite a healthy lifestyle? If so, chronic stress may be playing a bigger role than you think. But the good news is, this cycle can be broken with awareness, support, and the right tools. Up next, we'll explore how anxiety medications fit into the equation and what role they can play in controlling both your mood and your blood pressure. Anxiety medications and their impact on blood pressure. When anxiety starts to affect your daily life and your blood pressure, many people turn to medications for relief. But here's what most people don't know. Some anxiety medications can help lower your blood pressure, while others can actually make it worse. Understanding how these drugs work is essential if you're managing both anxiety and hypertension. Medications that may lower blood pressure. Some medications used for anxiety have a dual benefit. They calm the nervous system and also lower blood pressure. Beta blockers, e.g. propranolol, atenolol, originally developed to treat high blood pressure, reduce heart rate, and block adrenaline effects. Often used off-label for performance anxiety or physical symptoms like trembling and rapid heartbeat. For people with both anxiety and high blood pressure, beta blockers can be a smart two-in-one treatment. Certain SSRIs, selective serotonin reuptake inhibitors, medications like sertraline, escitalopram, and fluoxetine, designed to treat generalized anxiety disorder and depression, can improve emotional regulation and reduce stress-induced BP spikes over time. Medications that may raise blood pressure. Some anxiety treatments, while effective for mood, come with a risk of increasing blood pressure, especially at higher doses or in sensitive individuals. SNRIs, serotonin norepinephrine, reuptake inhibitors, includes venlafaxine, Effexor, and duloxetine, Cymbalta, can increase norepinephrine, which may raise heart rate and blood pressure, often monitored closely in patients with hypertension. Benzodiazepines, Xanax, Ativan, Valium, fast-acting and effective for panic attacks, can cause drops in blood pressure initially, but long-term use may lead to tolerance, dependence, and unstable BP patterns. These should be used short-term only and always under medical supervision. Talk to your doctor if you're already taking medication for anxiety or depression. You've noticed BP changes since starting or adjusting a prescription. You're considering medication but have a history of hypertension. A knowledgeable doctor will weigh the pros and cons and may suggest a treatment that addresses both mental and cardiovascular health. Natural first-line approaches still matter. Medication can help, but it's not the only tool. Lifestyle changes, therapy, mindfulness, and exercise remain essential components of managing both anxiety and high blood pressure. Think of medication as a bridge, not the entire solution. Up next, we'll talk about the signs that anxiety is truly affecting your blood pressure and what patterns to watch for. How to know if anxiety is affecting your blood pressure. If you've ever wondered, is it anxiety or is it my blood pressure? You're not alone. Anxiety and high blood pressure can feel surprisingly similar, and they often show up together. But understanding the overlap and subtle differences can help you recognize when anxiety is driving your numbers up and when to take action. Shared symptoms of anxiety and high blood pressure. Both conditions can cause a racing or pounding heart, chest tightness or discomfort, dizziness or lightheadedness, shortness of breath, fatigue or brain fog, trouble sleeping. That's why so many people with anxiety worry they're having heart problems, and people with hypertension sometimes don't realize stress is the real trigger. Spotting the patterns. Here are signs that anxiety may be influencing your BP. Your blood pressure spikes suddenly, especially during stressful events. You get higher readings in certain environments, like at the doctor's office. Your BP is normal at home, but high in public or social situations. You experience physical symptoms, like shaking, sweating, chest tension, along with the BP spike. The numbers often return to normal after rest, deep breathing, or a calming activity. If these patterns sound familiar, it's likely that your nervous system is driving your BP up temporarily, not a permanent condition. This is sometimes called transient hypertension, and while it's not the same as chronic high blood pressure, repeated episodes can still cause wear and tear on your arteries over time. The role of home monitoring. A great way to differentiate anxiety-driven spikes from chronic hypertension is through regular home blood pressure monitoring. Check your BP twice a day, once in the morning, once in the evening. Sit quietly for 5 minutes before taking your reading. Track your numbers over a week or two to look for trends. If your readings are mostly normal at home but spike during anxious moments, you may be dealing with stress-induced hypertension. When to see a doctor. If you notice BP consistently over 140/90 millimeters of mercury, even at rest, sudden spikes paired with chest pain, vision changes, or severe headache, anxiety that interferes with daily life, work, or sleep, it's time to talk to your doctor. They may recommend a 24-hour ambulatory BP monitor or additional tests to determine whether your high readings are situational or sustained. If you suspect anxiety is playing a role in your blood pressure, don't ignore it, but don't panic either. With awareness, home monitoring, and a holistic approach, you can learn to separate anxiety from hypertension and treat them both the right way. Next, let's dive into natural ways to manage anxiety and lower your blood pressure at the same time. Natural ways to manage anxiety and lower blood pressure together. The best part about understanding the anxiety-blood pressure connection? You can target both at once, naturally. By calming your mind, you help relax your blood vessels. And by supporting your cardiovascular health, you give your nervous system a calmer baseline to operate from. Here are the most effective natural techniques to reduce anxiety and bring your blood pressure down, safely and sustainably. 1. Deep breathing and relaxation techniques. One of the fastest ways to reset your nervous system is through your breath. Try this simple method. Inhale slowly through your nose for 4 seconds. Hold for 4 seconds. Exhale gently through your mouth for 6 to 8 seconds. Repeat for 3 to 5 minutes. This activates the parasympathetic nervous system, lowering heart rate and blood pressure in real time. Also try progressive muscle relaxation, guided meditation apps, yoga or Tai Chi. 2. Prioritize restful sleep. Lack of quality sleep worsens both anxiety and blood pressure. Tips to sleep better. Go to bed and wake up at the same time every day. Avoid screens 1 hour before bed. Create a dark, cool, quiet sleep space. Avoid caffeine or heavy meals at night. Getting 7 to 8 hours of uninterrupted sleep is one of the most underrated blood pressure fixes. 3. Follow a blood pressure-friendly diet. Eating well helps stabilize mood and supports your heart. Focus on leafy greens, berries, bananas, beets, rich in potassium and nitrates, whole grains, nuts and seeds, calming magnesium and fiber. Lean proteins like fish, tofu, or legumes. Limit caffeine, alcohol, sugar, and especially sodium. The DASH diet, dietary approaches to stop hypertension, is proven to lower BP, and it's also anti-inflammatory and mood stabilizing. Get moving daily. Exercise reduces anxiety, improves sleep, and lowers resting blood pressure. Even 30 minutes of brisk walking 5 days a week can lower systolic BP by 4 to 9 millimeters of mercury, reduce cortisol levels, boost mood-enhancing brain chemicals like serotonin and endorphins. Bonus, physical activity trains your cardiovascular system to respond more calmly to stress. 5. Sunlight, social connection, and nature. Spending time outdoors improves mood, increases vitamin D, linked to lower blood pressure and reduced anxiety, promotes grounding and relaxation. Whether it's a walk in the park or coffee with a friend, these simple habits buffer your stress response and support heart health. Start small, stay consistent. You don't need to change everything overnight. Even small steps, like a daily 10-minute walk, a calming morning ritual, or swapping salty snacks for fresh fruit, can make a big difference over time. These habits work better together, and the effects compound, gently lowering both your blood pressure and your anxiety levels. Next up, let's talk about when anxiety and high blood pressure need medical attention, and how to have that conversation with your doctor. When to seek help and what to ask your doctor. You've tried breathing techniques, you're eating better, you're doing all the right things. But if your anxiety still feels overwhelming or your blood pressure won't stay in check, it's time to bring in professional support. And there's no shame in that. In fact, asking for help early could prevent serious complications later. Signs you should talk to your doctor. Reach out to your healthcare provider if your blood pressure consistently reads 140 over 90 millimeters of mercury or higher. You experience frequent panic attacks or unshakable tension. You notice symptoms like chest pain, blurred vision, headaches, or shortness of breath. Your anxiety is disrupting your sleep, relationships, or work. You've tried self-care tools for weeks but don't feel better. These symptoms could signal underlying conditions like chronic hypertension, anxiety disorders, or both, and treating them early reduces long-term risk. How to talk to your doctor about it. Be honest and specific. Your doctor is there to help, not judge. What to say? I've noticed my blood pressure spikes when I feel anxious. I've been feeling tense every day, and I'm worried it's affecting my health. My BP readings are inconsistent. Could anxiety be the cause? Is there a way to treat both my anxiety and blood pressure together? These prompts help guide the conversation and give your provider the context they need to recommend the right tests, treatments, or referrals. What your doctor might recommend. Depending on your situation, they may suggest home BP monitoring for more accurate, stress-free tracking, 24-hour ambulatory blood pressure testing, referral to a mental health provider, medications that treat both BP and anxiety, like beta blockers or certain antidepressants, Therapeutic interventions like cognitive behavioral therapy, CBT, or biofeedback. You're not alone and you don't have to guess. Many people live for years with undiagnosed anxiety-driven hypertension simply because they didn't know the signs or didn't feel confident speaking up. But when you combine professional medical care with natural tools and lifestyle changes, the results can be life-changing. You're not just managing numbers on a screen, you're learning to calm your body and protect your future. And that's one of the most empowering things you can do for your health. Up next, let's wrap up with a clear conclusion and final takeaways to reinforce the message and motivate action. Conclusion. Anxiety and high blood pressure may seem like two separate issues, but as you've now seen, they're deeply connected. What affects your mind affects your heart, and what strains your heart sends signals right back to your brain. This hidden link is often overlooked, yet it's one of the most important keys to unlocking better health. You're not powerless. If your blood pressure has felt stubborn or unexplained, if anxiety has left you feeling wired, drained, or both, know this. Understanding the mind-body link puts you back in control. You don't have to fix everything overnight. Start small, breathe deeper, pay attention to your body, and when in doubt, ask for help. What you can do, starting today: track your BP at home, see how stress affects your numbers. Practice calming techniques like deep breathing or meditation. Move your body daily, even if it's just a 10-minute walk. Limit caffeine and sugar, especially during high-stress days. Get 7 to 8 hours of good sleep. Your nervous system needs it. Talk to a doctor if your anxiety or blood pressure are hard to manage. These are not just health tips. They're steps toward freedom from the cycle of tension and pressure. Anxiety isn't just in your head, and high blood pressure isn't just a number. They are signals, and they're asking you to slow down, tune in, and take care. If this video helped you understand that connection better, do us a favor. Like the video. Share it with someone who needs this information. Subscribe for more. Stay calm, stay strong, and we'll see you in the next video.